Okay, so let's finish off this last one, okay, the the blood pressure regulation. So we talked about, so again, the reason why I go, and here I take some time to explain because you have to understand this, and you will see all the medications that you are going to learn once you go into your program, everything is based on the physiology, okay? If you want to reduce blood pressure, you can stop some of these things. So everything is connected. At this moment in time, maybe the light bulb won't go off. But trust me, once you go into the program and then you start learning about diseases, about medications that are used for diseases, then it will click back. And then that is the time you'll really understand it very well and you'll say, oh, now I get it. Why? Why is this drug able to decrease the blood pressure? Or why do I see this in this disease? So it'll make sense. It'll all make sense. But it'll only make sense if you at least remember something out of this. If you forget everything, then it's going to be very difficult, okay? So blood pressure regulation, short-term regulation, that means within minutes, if you want your blood pressure to get back to normal, that is a neural mechanism. It's called the baroreceptor reflex. We talked about these baroreceptors. So every time your blood pressure tends to, so here's this, if your blood pressure tends to go above the normal range, and when we say blood pressure changing, we are talking about the mean arterial pressure, okay? So his name is Carlos. So it is the mean arterial pressure which is being regulated, not the systolic or the diastolic. The body is not homeostatically controlling the systolic or the diastolic. It is regulating this mean arterial pressure, which I said is anywhere between 93 to 100 millimeters of mercury. Okay, this is what is being controlled. So when the mean arterial pressure goes above the normal range, 110, 120, let's say you're anxious about something, it goes up. So immediately it is detected by the baroreceptors in your aortic arch and carotid sinus. They send action potentials through the glossopharyngeal and the vagus nerve to your medulla, where you have the neurons that control your heart and your blood vessels. And what is this cardiovascular center going to do? It has to reduce the blood pressure. So it has to reduce the heart rate, it has to reduce the stroke volume, and it has to dilate the blood vessels so that the resistance drops. So this is what happens as a response, and then your blood pressure comes back to normal, okay? And the opposite of this, if blood pressure were to drop, mean arterial pressure were to drop, which is what happens when you get up from the lying down position in the morning, early in the morning. As soon as you get up, this is what is happening. So the baroreceptors detect that drop in mean arterial pressure. They pass on the information to your medulla, and the medulla now has to raise your blood pressure back to normal. So in order to raise it, it has to raise the cardiac output, and it has to also increase the resistance. So heart rate will go up by about 10 or 15 beats. The heart rate will go up, stroke volume will go up, and the blood vessel will constrict. So that resistance increases. So this is the equation. Mean arterial pressure is cardiac output times resistance. You want to reduce the pressure, you have to you have to decrease cardiac output, you have to decrease resistance. You want to increase the blood pressure, you have to increase resistance, you have to increase the cardiac output. So this is something that is very important, okay? And as age advances, the baroreceptor reflex becomes weaker. These receptors don't respond so quickly. So that's why your elderly grandparents, they take some time to get up from the lying down position. It's not easy. If they get up very quickly, they may fall, they may faint. okay, because blood flow to the brain will decrease. That's why you see many elderly people, they have falls, especially in the bathroom, they fall down, because when they get up from the toilet seat, suddenly the blood pressure may drop. So the blood flow to the brain decreases and they faint. They fall down unconscious, okay. So that is short-term regulation. Now let's look at the long-term regulation of blood pressure, which is hormonal, okay. And this mechanism is called the renin-angiotensin aldosterone system. Okay, so this is the long-term regulation of blood pressure. It's briefly known as RAS, R-A-A-S, renin-angiotensin aldosterone system. Again, for those dental hygienists, blood pressure regulation is very important, because your dental chair, you keep raising it, you keep lowering it. So if you have an elderly patient on the dental chair, you have to be very careful. You can't do an abrupt change, okay? It will cause problems. So this is something any healthcare worker should be aware of. So this is a hormonal-based mechanism which helps to maintain the blood pressure over a longer period of time, weeks and months. So baroreceptor reflex is short. Immediately it will bring it back to normal. But then if the blood pressure tends to be high or low, you need this mechanism to ensure that the blood pressure returns back to normal and stays normal. So what is this system? So try and understand this, because this is an important one. Again, when we do kidney, this will come up. But okay, so all of this, renin is actually a hormone that functions like an enzyme. Okay. Angiotensin is an intermediate substance. This is intermediate. Aldosterone, you already know, aldosterone is a hormone released by the adrenal cortex. Okay. So when does this system operate, or when is this system going to work? So this system is stimulated, this system gets activated whenever blood sodium levels decrease. Okay, salt levels when they decrease. Blood volume decreases. Mean arterial blood pressure decreases. So there are three things which will activate the system. A reduction in the amount of salt in the body, a reduction in the amount of blood that is circulating in your body, blood volume, and a decrease in the blood pressure. Now, all these three are related. They are all related. Salt always attracts water. Okay? So, if the body has less salt, if there is less salt in blood, that means automatically there is less water. Now, you have experienced this. When you eat salty food, if you consume a pizza for your dinner, there's so much of cheese and salt in it, you feel very thirsty. So, you always have a drink along with that. Okay? Or even through the night, you have to get up a few times to drink water, because salt always attracts water. If there is less salt, there is less water in the body. If there is more salt, there is more water in the body. So when blood salt levels decrease, automatically volume will decrease, because water is also less. Okay? And once blood volume decreases, that is from 5 liters of blood, 5 to 6 liters, if it drops to, let's say, 4.5, automatically your cardiac output will also decrease because the amount of blood that is in your body is less. So, when cardiac output decreases, mean arterial blood pressure will also decrease. So, all these three are related. All these three are related. Okay? So, suppose you are in the habit of consuming less salt in your diet. You don't like too much of salt. You reduce the amount of salt. Automatically, the amount of water in your blood will also be slightly less, and your mean arterial pressure will be lower. It will not tend to be very high. If you are the type who puts in a lot more salt in your food, your blood volume tends to go up and your blood pressure also tends to go up in the long run, not short term. Because as long as you're healthy, your kidney will adjust the salt levels. If you consume too much of salt, the extra salt will be thrown out in urine. If you don't consume too much of salt, the kidney will retain salt for you, because we need to maintain the blood salt levels. We need to maintain the sodium levels. Okay? But any time when any of these three happens, this system gets activated, because ultimately your pressure starts to go, mean arterial pressure starts to go down. Yes? This angiotensinogen is a protein made by the liver and it is circulating in the plasma. So, the moment renin is released, renin is going to act on this angiotensinogen and convert it to an intermediate product called angiotensin 1. Okay, so this will happen as blood is flowing. As blood is flowing, this is going to happen. Okay, renin will convert angiotensinogen to angiotensin 1. Angiotensin 1 then gets converted to another substance called angiotensin 2. And this angiotensin 2, this conversion of angiotensin 1 to angiotensin 2 happens when the blood is flowing through the pulmonary capillaries, when it's going through the lungs. Okay? The right ventricle pumps the blood into the lungs. So, in the pulmonary capillaries, this conversion occurs. Why does it happen in the pulmonary capillaries? Because the capillaries, the endothelium, right, the cells that are lining the capillary, they have an enzyme that is stuck to the cell membrane. There is an enzyme. The enzyme is called angiotensin converting enzyme. Angiotensin converting enzyme, or ACE for short. Angiotensin converting enzyme. So, this conversion occurs as blood is flowing through the pulmonary blood vessels. Why? Because the pulmonary blood vessels have this enzyme. The cells have this enzyme which is stuck to the cell membrane. So, as blood is flowing through, the angiotensin 1 gets converted to angiotensin 2. Now, angiotensin 2 is the active substance that is going to bring blood salt levels back to normal. It's going to bring the blood volume back to normal, and it's going to bring the blood pressure back to normal. So, angiotensin 2 does it. Okay? Now, what are the actions of angiotensin 2? What does it do? How does it bring everything back to normal? 4 major actions. 4. Okay? Number 1, angiotensin 2 acts on the thirst center in the hypothalamus, that is the neurons that are responsible for your thirst sensation. So angiotensin 2 is going to be made in the blood and it will circulate in the blood. So it acts as it goes through the brain blood vessels, it acts on the neurons in the hypothalamus and it increases thirst sensation. So what would be the effect of this? The effect of this would be increased intake of fluid, which in turn will increase blood volume. Okay, that's the first one, first effect. Second, angiotensin 2 stimulates posterior pituitary gland to release ADH. So it acts on the posterior pituitary gland to release ADH, anti-diuretic hormone. What will this do? ADH conserves water. It won't allow water to be lost in urine. And because of this action, blood volume will increase. Okay? Number 3. Yeah. ADH conserves water, increases blood volume. Third effect, angiotensin 2 causes vasoconstriction. Vasoconstriction of arterioles. Vasoconstriction of arterioles. Okay, when arterioles constrict, what will happen to resistance? Increase, very good. Increased resistance. And when resistance increases, what will happen? Blood pressure will increase. Okay? When blood volume increases, blood pressure will increase. Okay? Now last action. Stimulates, angiotensin 2 stimulates aldosterone release. Aldosterone release from adrenal cortex. So it stimulates the release of the hormone aldosterone. And what does aldosterone do? Aldosterone causes sodium retention. It acts on the kidney to cause sodium retention. Salt retention. And whenever salt is retained, water will automatically be retained because salt and water go together. So sodium retention and water retention. What will this do? It will increase blood sodium levels and also it will increase blood volume. Once sodium and blood volume increases, mean arterial pressure will increase. This was our goal. This was the goal, to bring the blood pressure back to normal. Okay? So these 4 actions of angiotensin 2 are important. Okay, these 4 actions. So when does this entire system get triggered? It gets triggered whenever blood volume is low, blood sodium is low, blood pressure is low. Okay? So that's another thing. And again, the reason you might think everything is here, why do I also write it? The reason I write is when you write, I know many of you take pictures, it's fine. Do you ever go back and look at those pictures at any time?
If I do, yeah.
If you take pictures. Because sometimes I take pictures too in a conference, but I never go back and look at it. The only thing is when I write something, that's when things get into my brain really well. Okay, so that's why I draw, I write. So I understand it better when I'm actually writing it. And there is research to prove that when you move your muscles, it actually increases your memory. Okay, rather than just opening a book and reading everything, it helps to embed things in your memory. So that's why I write it, and as far as possible you can also write. You don't have to write the whole thing, vasoconstriction, you can just, whatever short form you like, you can do that. It's a good idea to write, or at least when you're studying, try to quickly write things as you are remembering. Okay, it just helps to boost your memory. Was there a hand up? I was talking, I forgot. Omar, did you have a question? Yes. Hospital, you see a patient, okay, and you read the notes, and it says that this patient has a renin secreting tumor. Tumor is like a cancerous thing. So there is a renin secreting tumor in the kidney. Okay, so this cancerous tissue is constantly releasing renin. Okay, so that is what you see in the patient. What will be the blood pressure like in this patient?
Too high.
Very high, too high. Is that straightforward for you? Yes, because renin is only released when blood pressure goes down. But if somebody has a tumor, it is going to constantly be forming angiotensin II, and angiotensin II will be doing all this, so blood pressure will always be high. So this person will have very high blood pressure. What about salt and salt levels in the body? What will be the salt levels? Also very high, okay? So salt levels will be extremely high. So this is, although a rare problem, this can occur, okay? It can occur. So there will be people who come with very high blood pressure. So then you will have to check what is the reason, and very rarely you will find that some of them will have a renin secreting tumor in the kidney, or it could be a tumor elsewhere which is secreting renin. Okay? Yeah.
So if it's possible to secrete too much renin, then is it still possible to secrete not enough?
Usually the amount of renin that is secreted, the hormone levels are really less, very less. Okay? So suppose you see a patient who has kidney failure, then if the kidney is damaged and the renin producing cells are damaged, then the blood pressure will be low.
So would the baroreceptors be forced to pick up the slack, or is it just...
They will, but the baroreceptors cannot function for a long time. They are like quick to respond and quick to finish, that's it. So they are not good for extended period of time.
Like additional outside of...
Yes. Yeah. And baroreceptors usually get adapted. Suppose a person let's say a person consumes a lot of salt. So when they consume a lot of salt, there's a lot of water, so their blood pressure tends to be high. So the baroreceptors get adapted to that high pressure. So initially they'll try to drop it. But then afterwards, if the same thing continues, the baroreceptors think, okay, the higher pressure is the normal. So they adapt themselves. Okay? Yeah. And next question, which is again one of the important ones. Okay? Let's say I have a drug, I have a medicine that blocks the activity of this enzyme. It doesn't allow this enzyme to function. Okay? It will stop this enzyme from doing its action. What will be the blood pressure in the patient in whom I have given this drug?
Lower.
The blood pressure will be low. Why? Because angiotensin 1 will not be converted to angiotensin 2. None of these things can happen. Okay? So, ACE inhibitors, exactly. So these drugs which are used to bring down the blood pressure, they are called ACE inhibitors. So when you take a pharmacology class and learn about drugs that are used for hypertension, one group of drugs is the ACE inhibitors. Okay?
Do diuretics only suppress ADH secretion?
Diuretics increase, good question. When we do kidney, we'll come to that. Diuretics increase the loss of water in urine. By doing that, they decrease the blood volume and then they decrease the blood pressure. Okay? So when you see a patient with high blood pressure, they are sometimes given a combination of drugs. They are given an ACE inhibitor and they are also given a diuretic. Okay? So both of them will function. So diuretics can be used because diuretics will help to decrease blood volume. So that's why I want you to see this connection between sodium, water, volume, and pressure. They're all linked. So if you decrease the blood volume, you can decrease the blood pressure. Okay? Sometimes we also give medicines which decrease the heart rate. Beta blockers. We give drugs which decrease heart rate. How will drug that decreases heart rate, how is it going to reduce blood pressure? Once heart rate decreases, what will happen? Which one is going to go down? Cardiac output. Cardiac output goes down. Once cardiac output goes down, blood pressure will go down. So this is why when you need to know the physiology in order to understand how the drug works. So at that time when you're taking a pharmacology class, nobody is going to talk to you about cardiac output is heart rate times stroke volume. No, they expect you to know it. Okay, so at that time if you're clueless, none of this will make sense. When you're learning about drugs, it will not make sense. Okay, so that's why this is much more than anatomy, the physiology is important. Okay, anatomy is needed for surgeons. They need to have anatomy at their fingertips. But physiology is something everybody you need to know because without that you won't understand things. Okay, so ACE inhibitors are very commonly used for decreasing blood pressure. Okay, yes. Up with that, I want you to pick up your lab reports before you go. So have a wonderful spring break. If you look at the schedule, and I'm sure some of you have, the second exam, which is on cardiovascular and respiratory, is scheduled for the Wednesday after you come back, okay? Obviously, we can't have it that Wednesday because we haven't even started respiratory system, okay? So it'll probably get pushed to the following week or the week after. So just keep that in mind, but don't